Liposuction refers to a surgical technique of fat removal. And very specifically, it's fat removal being sucked out through thin metal tubes known as cannulae, or a cannula in singular. And the important thing to bear in mind is that with liposuction, we're not removing any skin. So we're emptying out an area of fat, and then the skin itself has to shrink wrap around that area afterwards. So after surgery, there'll be an improvement. Then there'll be swelling that will fill up the empty space, and that swelling will take time to go down. And also the skin contraction that's required can take up to a year. So with any liposuction procedure, we always have to be careful not to assess the final result until a year after surgery to allow the maximum amount of skin contraction to have occurred. Small volume liposuction, and by this we tend to refer to under a litre, can be done under local anaesthetic, but most other liposuction will be done under sedation or usually a general anaesthetic. It involves fluid being infiltrated or injected into the area that we'd like to reduce in terms of fat, and then after allowing that fluid to be present in that area for a certain amount of time to reduce blood flow and to increase the turgidity of the tissues, we can then suck out the liposuction fluid, which will include fat, some of the infiltrated fluid, and there'll be a little bit of blood in there as well. There are different methods of liposuction, but essentially all revolve around aspirating or sucking out the fat from that predefined area, whether it's using assistance with power-assisted, ultrasound-assisted, or laser-assisted liposuction. The goal is the same in all of them. It is actually quite common to combine liposuction with other procedures. Typically, for example, a tummy tuck may also have liposuction done to the flanks and some of the surrounding areas. Sometimes a facelift will have liposuction done under the jawline, under the chin here, to improve the contours. The exact combination is not prescribed, and it can vary between different people. And of course, liposuction can be done as a separate procedure completely from something else at the same surgical sitting. The scars for a liposuction procedure are very small. They tend to be 3 to 4 millimeters in length, and there are normally at least 2 scars for any one area that we're going to liposuck the tissue from. And the reason for that is we don't want an over-concentration on, and then a risk of a divot or a contour irregularity if we're only sucking from one particular area. So sucking from 2 areas allows crossover of how we're sucking to allow a more even spread of the evacuation of the fat from a particular area. Recovery after liposuction tends to be fairly rapid. The main issue is one of post-operative swelling and often bruising. So that can feel very achy, and I'd normally say expect to feel like you've done a really, really tough workout and the areas that you've had the surgery to will feel very achy. So certainly I wouldn't recommend any exercise for 2 to 3 weeks, depending on how much has been removed. And the swelling will gradually dissipate after that, and most of it will go after 6 weeks, but there will still be some residual swelling for a few months even after your procedure. So you'll continue to get an improvement after that, and that will be helped by massage and other post-operative instructions you'll be given. Risks associated with liposuction surgery include bleeding and infection. Bleeding is something that can occur significantly with particularly large volume liposuction, so over about 5 litres of liposuction. Scars are going to be small, there will be bruising, that's inevitable. And I think from an aesthetic point of view, uneven contours are the things we are most concerned about. So trying to make sure we do as good a job as we can in theatre in surgery is crucially important, but also post-operatively massage and wearing garments will also help improve your outcome and your contours. Finally, with larger volume liposuction, blood clots can be associated, so giving you appropriate anti-clotting medicine will be very important. And occasionally people can have fluid build-up, seromas as well, that may need to be drained off in clinic.